Welcome to this show discussing problems and issues of health with Dr. Alcena. For this segment of this show, I'm going to continue to talk about COPD. Last week, I believe I ended a series on asthma, and this segment I want to begin to talk about COPD emphysema. Very, very common medical problems that affects so many people in this country. 12 million folks have COPD emphysema, and another 12 million folks are not yet diagnosed with it. So that's a very large number. And worldwide, 600,000 people have 600 million. I'm sorry, 600 million people have COPD emphysema. It's a serious problem. Before I do that, however, I want to take a couple minutes of your time to go over something with you that is of major importance. I do that about once a year. You know, HIV/AIDS is a major, it is the epidemic of the 20th and the 21st century. We first were become aware in publication of this epidemic in June of 1981, I think it was. Ever since then, a whole lot of stuff have happened. As you heard, many of the most uh, powerful people and brainy people in the HIV world research community died in this unfortunate plane that was shut down in the Ukraine, where 298,000 people lost their lives. And of course, my hat goes out to their families, etc. That they were in their way to a conference in Australia, and the conference took place. And I have here this issue of JAMA, Journal of the American Medical Association, that catalogs the entire uh, conference, what they talk about, what the recommendations were, etc. Uh, Among the topics that were in the forefront and discussed in this conference of AIDS was, of course, the necessity to start people who just become infected with medication immediately. So that was one key point. The other key point, as I'm reading this, that really came through very clearly was the recommendation made by the World Health Organization for all sexually active men who are not circumcised across the world to voluntarily have circumcision done. That's a major, major recommendation. Heretofore, we know about what had happened in Africa, where they did the research there, and that was published in 2007, where circumcision decreased the incidence between 53 and 60% of HIV/AIDS. That came out, and we know about that. In addition to that, it was clearly discussed and mentioned the fact that after the research was done, the researchers went back, they kept track of these women that were part of the study. They found a tremendous decrease of herpes, HPV, and gonorrhea and other STDs in these women whose husband and boyfriends had their foreskin of the penis removed. Very, very, very important information that was discussed at that conference. And in addition to that, more than 1 million men so far have undergone this procedure, mostly in Africa. So now the World Health Organization is pushing it worldwide. And of course, the tremendous benefit that have been seen so far in the decrease in HIV/AIDS transmission is in the millions. And of course, I'm bringing this to your attention because I'm not an AIDS expert, I'm not an AIDS specialist. However, I wrote this book in 1994 on AIDS. 1994, there was the only book of its kind at that time. It was just in the beginning of the epidemics. People were scrambling around trying to find out what to do, come up with ideas and whatever. And I got involved because most of the poor folks in the community where I practice, nobody wanted to touch them because they thought that they had AIDS, and AIDS was something that can be transmitted through the air. All kind of nonsense. People, they thought AIDS was the plague. So, and I got involved because some of them, believe it or not, these poor folks were patients of mine, because I have a practice. I have a lot of folks from the developing world and I was seeing all these different things. So I rolled up my sleeve and got involved. That's how I got involved. I was not trained as an infectious disease specialist. I'm an internist. Of course, infectious disease, as you know, is a subspecialty of internal medicine. And in so doing, I practice it and I teach it because when I make a teaching around, people present with infectious disease problems. As the attending physician, I have to teach the interns and the residents about the subject, that whatever the disease they present with, the infection, and how to manage it and treat it. So it's no big deal. I'm not unique. That's what uh, internists who teach medicine do. You just don't internal medicine. Whenever you're making morning rounds, you never know what you're gonna get. It's gonna be a cardiac case, an infectious disease case, an endocrine case, God knows what. You have to deal with it. So I got involved and I made major contributions. And to this day, whenever they have these conferences, you don't hear my name. And you don't hear my name. And anyone who tell you they would have come up with an idea that was published in a peer-reviewed journal in August of 1986 that have made such a tremendous difference in a particular disease in the world. No one, to the best of my knowledge, and I read the literature, I write the literature, and the 20th and the 21st century has not come up with any idea that has made a bigger difference than the idea that I came up with male circumcision and dealing with any medical issue in the world, period. So my name is not mentioned, and it's kind of touchy subject with me because I was the one who wrote the article that 1986 that recommended that male circumcision should be done to decrease the transmission of HIV/AIDS, and I explained clearly and fully what I was seeing in my office that will create an issue for the transmission of this disease so very easily if these men were not circumcised. And I'm not going to describe this to you here, but you could read in the book. So these people decided they were going to do this research, which is fine, was a great thing. They did a great job. It was fantastic research. It was so powerful that they stopped it ahead of time as by regulation and released the information. Great thing. Okay. Only problem is the idea was not theirs. And of course, I was not included. I was never asked. I was never participated. I didn't do the research. I think it was great research. They did a great service to society and to the world. No question about it. Problem is, if you're going to do research, to the best of my knowledge, and I've been chief of medicine and director of services over the years, I know the rules. You're going to have an idea that is original, and you're going to have disclose it to the committee, and then ask grant money to do the research. And if the idea is not yours, then it's not yours. Then you may not get the grant. Or if you still want to do it as a redo, that's up to the committee. Well, many major institutions, and I'm not going to name their name, some of them very powerful, most of them very powerful in this country and around the world, participated in this research. I got editorial written by the group from France, the two universities, to congratulate me, blah, 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 for that idea that I came up with because they participated in it in Africa. But the folks in America, I don't exist. One guy was very nice of him. He was, in fact, in charge of the research project from Harvard. Again, I don't have to mention his name. He was very kind, very humble of him to call me. He called me. So that was very nice of him. But the other guys, I don't exist. I don't exist because if they mention my name, they're going to ask, well, who's this Valiere Alcena? They have to explain. How did Valiere Alcena get involved in this? They have to explain that I wrote the article in 1986, that I proposed the idea. I described the whole thing. All this thing having to do with gonorrhea, the lesion, and I described all that stuff. I predicted what was going to happen, pretty much. So my name is not mentioned. Every year they have this major conference. Believe me, the art medication has done a fantastic job. But it costs $15,000 a year average to treat somebody. And most poor folks can't afford the art medication. It's not a cure. It is pretty much a medication that turns the AIDS into a chronic disease, which is a great thing. But you can't compare that to the prevention of millions of cases that didn't occur because of an idea that was turned into a research that document that it's work. And this is something they're so proud of. And this particular conference, a big chunk of it, I mean, I have the whole half a page here. I can't read the whole thing to you. What happened, okay? The World Health Organization recognized me, which is fine. But these folks in America, they have such egos, and they don't like people with my color. They don't think people with my color can achieve anything. That is absolutely false. We've achieved a lot of stuff. And they don't want to mention my name. Let me give you an idea of all the contributions that I've made in the AIDS epidemic. Male circumcision, the whole concept of parasitic infestation causing false positive HIV, which is what happened in the beginning of the epidemic before we had Western blot and other ways of doing extra step. Because in those days they were doing just the ELISA. That's all they had. And there were a lot of false positive. I had such cases, I published them. Second. Third contribution. A lot of gay men in the early, mid-80s, early 90s were very depressed over the fact that what was going on with them in their lives. They decided to go to visit bathhouses with the full knowledge they wanted to catch AIDS as a means of committing suicide. Well, I was teaching at Cornell when I did that article. I published the article. It was published in the American Journal of Psychiatry. Big, big article. Made a big impact. So that's number 3. Number 4, whenever you see somebody boxing in a boxing match, I was the first one to write an article that shows that one boxer can transmit HIV/AIDS to another, to the blood that's splattering all over the place when they're hitting each other and bleeding, all that stuff. And I recommended that the handlers, the referee, and all these people wear gloves. So that's not a contribution. Several more that I've done. But I'm not an HIV/AIDS expert. I'm an internist, and it is not unusual for people who are not part of a specialty to make major contribution. Look at H. pylori. The doctor who got the Nobel Prize for the idea of H. pylori is a general practitioner in Australia. He's not the GI doctor. He got the GI doctors to do the test for him when he suspected that his patient must have been carried the bacteria and the gut causing them to be sick. Hence, he discovered H. pylori. So what's the big deal? The only big deal is the fact that in Australia, he's white. In America, I'm black, so therefore I should be kept in the back room. Why should they give me credit? Then that take credit away from them. And if they don't understand when they do that, it's belittling them, really. It's really making them look so bad. Because what's the big deal? I'm alive. The article is in the literature. I'm not dead yet. So why ignoring me? For what? I don't claim to be an AIDS expert, but I did something. I did those things. I wrote them up. As a matter of fact, the AIDS thing is copyrighted. It's on my website, and my website is copyrighted with all its content. So what is the big deal? No, they are the ego. They can't afford to include a black man in something so incredibly great that he did. So to this day, whenever they have this big hoopla in Washington, D.C. last year, they didn't mention my name either. You name me one thing that any single one of these AIDS experts have done that surpasses the idea of male circumcision. Name me one thing. Sure, the art medication is great, but you have to have $15,000 a year in order to take the art medication, in order to stay alive. It's a great thing. I have a lot of patients of mine who are on art. I prescribe it all the time. I still have patients of mine in the mid-80s who have HIV. They're still alive. I'm still taking care of them. They're doing very well. And I'm not an AIDS expert. I spent years at Montefiore teaching on the AIDS wards. Cloud 6, Cloud 5 it is, yeah, Cloud 5, okay? What's the big deal? I have a brain. The people who become infectious disease, they're no smarter than I am. Far from it. So what is the big deal? I just thought I'll mention this to you so that you know that I've done all this stuff. And I wrote the book as well. Look at the book. And this is the 1994, in the very beginning. And this book was reprinted at least 6, 7 times and was published all over the world. All right, so that's all I want to say about this subject. And I'm not saying it to be arrogant or to be angry or anything. I'm just saying it, you would do the same thing. If you did something so outstanding, and you're being ignored by people who are not involved, and they're using it to make a name for themselves, which is, I have no problem with that. But I'm here, I'm still alive, and I'm reading the literature. How do you think I feel? I pick this drama, and I say, oh my goodness, a male circumcision really get a big play in this conference. Well, it should, because this is a great thing. The foreskin is a very dangerous thing, and it should be removed, period, because it doesn't do any good for anybody but then transmission of diseases that are very lethal. In any event, COPD, emphysema. COPD emphysema. 6 million people die every year because of emphysema COPD. Okay? It is a very, very bad disease, okay? And across the world, 600 million people have COPD emphysema. And of course, you can't talk about COPD emphysema without talking about cigarette. Oh boy, now we're talking about cigarette. Well, chapter 32 in this book, Health Status of African American, is on COPD emphysema. Take a look at it. This is the latest book that I wrote. It's a few months old. You can find it in your local public libraries. So whatever I don't say here, you could read the book and you will get more knowledge about what I have to say. In any event, COPD. What is COPD? It's a disease whereby some toxic material, like cigarettes, and there are many other things that I'll be mentioning, damage the lung tissue, causing the lung not to be able to exchange oxygen properly. Consequently, people have difficulty breathing. And secondarily to that, they develop a lot of problem with the heart. Because when you have COPD emphysema, you're likely to have right heart disease. Well, if you have right heart disease, in an attempt to compensate, you develop left heart disease. So people with COPD emphysema frequently die of congestive heart failure as well, especially right heart failure. Very, very serious problem. You develop pulmonary hypertension, which causes right heart disease, and then the left heart has to do too much work, and you wind up with left heart disease as well, when the heart fail and they die. Okay, let me give you an idea how. By the way, the COPD emphysema cost this country $49.9 million. Billion. $49.9 billion is what the COPD emphysema costs this country every year. Okay, now, risk factors for COPD emphysema: cigarette smoking, cigar smoking, air pollution, industrial exposure to pollution, black lung coal miner disease, alpha 1 antitrypsin deficiency. 2% of COPD patients who don't smoke, you can't find a reason for it. You should test them for alpha 1 antitrypsin deficiency. Okay? Cystic fibrosis, cotton textile workers, people who work in the cotton textile, where the machine is working on the cottons to create different stuff. The fibers of the cotton get inhaled. They wind up with COPD emphysema. Exposure to cadmium, which is a chemical substance, exposure to welding fumes, exposure to isocyanates, exposure to silica dust, exposure to asbestos, exposure to sugarcane cutters. Now, I cut sugarcane. I don't have COPD, but I did. When I was a young man working in the farm, of all the terrible thing I had to do to make a living was cutting sugarcane. However, I don't think they cotton sugarcane, even so it's in the literature, there's it. It's people who are really, when the sugarcane is going through the machines and the fibers that's coming from the cane get into the air and you inhale that. So that's what can cause COPD. I don't think the sugar cane, because I cut sugar cane and I don't have COPD. But if you're working in the machine, when you put in the sugar cane through the machine, so that the machine can squeeze the liquid out of it, the fibers are being destroyed, and you could inhale that and get COPD. That's my take of that one. And sugar cane milled work. It's in the literature. Yeah, so they did put it. I'm sorry, they did put it there. They did put sugar cane milled worker. That's right, it's there. And if you have recurrent pneumonias, when you have recurrent pneumonias for whatever reason, there are a lot of folks who have conditions that cause them to have recurrent pneumonias. Their lungs subsequently become scarred because of the chronicity of the pneumonias that are of a recurrent nature, and you wind up with ultimately with chronic lung disease such as COPD. Okay, very very bad situation. So you really need, and I need to take a moment here to talk a little bit about cigarettes, because you really cannot do justice to the subject of COPD without really talking about cigarette, because cigarette is the number one culprit. Let me give you an idea what's going on. Okay, 1.1 billion people in the world smoke cigarettes. In the U.S., 42.1 million people smoke cigarettes. And worldwide, 5 million people die because of cigarette smoking every year. And in this country, 480,000 people die every year because of cigarette smoking. Let me repeat those data because it's really mind-boggling. 1.1 billion people use cigarette in the world every as I speak. 42.1 million people use cigarette in this country. And worldwide, 5 million people die every year because of the side effect of cigarettes. And in this country, the side effect of cigarette kill 480 million people every year. It is a terrible thing. Cigarette is really a bad thing. Okay, now this is a free enterprise system. The people have every right to sell it as long as people have our age and people are well informed what can happen to them. You can't tell people not to make a living. If this is what they do to make a living, they have the right to do it. But they don't have the right to make a product that kills people. If the product is killing people, they ought to clearly put that on the cover of the cigarette thing, which I think the FDA now, I'm sure, is pushing, if they have not already done it, to, at least you know what you're getting yourself into. And now they have this e-cigarette thing, which is it's a 1 point something billion dollar industry as well. See these kids in the street smoking this stuff. They don't know what they're doing to themselves. They're really hurting themselves very badly. So, and I'm not here to batch or to say anything bad about people who industry that makes cigarettes. That's not my role. I'm a physician. I can only talk about the health, the negative effect of cigarette on patients. Some of them patients I take care of. That gives me the right to talk about that aspect of it. As far as the other stuff is concerned, that's for the government and society to deal with. This is America. People have the right. This is a free enterprise system to make a living, to sell the product. It's up to us, either buy it or not buy it, as long as we know what it is that we're doing. Cigarette has about 4,000 chemical in it, okay? And 250 of those chemicals are known to be carcinogenic and they can cause cancer, okay? That's really all I want to say about cigarette. I mean, again, I'm not here to say anything negative about people who are making or selling cigarette or the cigarette industry. That's not my role. I'm a physician. My job is not to badmouth anybody who's making a living. It's just I tell my patient, don't smoke. That's my job. I tell my children, don't smoke. I tell my grandchildren, don't smoke. Okay? I mean, I grew up, I know a little bit about tobacco because I picked tobacco. It sounds like I did everything. No, it's just the life that I lived. When I was a young man, they had tobacco fields in Haiti, and it was a way of making a living. So I picked the tobacco. I saw the junk, the spraying on that stuff in order to prevent the insect from eating the leaves of the tobacco. They sprayed them with chemical. And unfortunately, I inhaled some of that junk because you can't. You touch this stuff. But that's my own personal experience. Okay, that doesn't. Everybody doesn't have the same experience. So I tell my kids stay away from that stuff. When I grew up, I was so darn poor. If I had money, I would have used it to buy food, but I don't buy cigarettes. I can barely eat. So as a result of that, I grew up. I never smoked because, frankly, that's not what I that's not what I dealt with. I was poor, hungry, and trying to survive. And I had nothing to do with cigarette. That's not the environment I grew up in. And the same thing with alcohol. I had nothing to do with these things. I was just eating my mangoes and my guava and my sugar cane, whatever I can find to fill my belly to stay alive for the day. Had nothing to do with that. If I had the money, believe me, I would buy candy with it. So in any event, cigarette and and uh, and cigar smoking are really one of the major culprits that can cause somebody to develop COPD emphysema. And I'll be doing several shows on COPD emphysema, and I'll be describing to you the abnormalities that develop inside the lung that cause people to be so sick. And that there are two types of COPD emphysema. You have the pink puffer, you have the blue bloater, and I'll explain to you what the pink puffer is and what the blue bloater is and the symptom, blah 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 blah. So you have plenty of time, and I thank you for listening to the few minutes that I took to explain to you what happened in HIV/AIDS. This is not a show on HIV/AIDS, but I have to mention to you some of the contributions there. And there are many other fields that I made major contributions. It's not just AIDS. A lot of other fields that I came up with ideas. Look at the blood pressure situation. If I were to tell you what I did, you will be shocked. In any event, all good stuff. I'm going to stop here. Until such time, keep watching this show. This is Dr. Alcena saying so long and bye bye.